Hi, Haley. Thanks so much for joining me today. Happy Friday.
Thank you. Happy to be here, Janae.
Today is sadly Haley's last day with us as a summer intern. So we wanted to have a conversation around what are the incredible things that she learned and did with us over the last 10 weeks. And just to get a sense for what is public health? What does that mean? It's something that ACUREI talks a lot about. It's in our mission statement. It's sort of at the core of who we are, but we don't often get a chance to really take a step back and talk about like, what does that mean? So just in case there are folks here who maybe haven't spent a lot of time with us or learned from us in our speaker series or other engagements in the past, I'll do a super quick intro. ACUREI was born out of this um, gap that Wyatt had identified at the federal level. If you're familiar with the term reentry services, they're services provided to folks as they're leaving the incarceration system, either prisons or jails. And the idea is to support them as they transition back into the community. And one of the ways that happens is through collaborative courts. So, court programs that are specifically designed to help people with an understanding that either mental health or substance use issues are the root cause for some of the criminal behavior, and that it's better to treat the individual's needs rather than simply punish them for what could potentially have stemmed from some other underlying issues and needs. So, a Curie specifically sits at that intersection of criminal justice and public health with a focus on folks under federal supervision, so at the federal court level. And every year we get the pleasure of hosting an intern with us, and you happen to be able to join us full time for the summer, which was really special for us having someone um, that could really dive deep into what we do and how we do it, and to do it from your perspective in this your public health lens, I think was really critical for us. So we're super bummed that this is the end of your time with us, but we want to make sure that everyone gets to hear a little bit more about who you are and what you did and why it's been so important. So. Why don't you tell us a little bit about you and the program that you're in and help folks understand what public health means?
Yeah, absolutely. Well, I first want to thank you all at this amazing organization for working with me this summer. It was just absolutely incredible. I love the work you guys do. I love public health, so I'm definitely excited to kind of sit down and talk a little bit more about it. So I just finished up my first year of my Master of Public Health program at Berkeley, and I'm specifically focusing a lot of my work and kind of my course load around health and social behavior, which is kind of this funky little term, but it's essentially learning about the systems that we live in and how this shape health outcomes for people. So I would say for me, public health is really about addressing kind of the root causes of health and poor health outcomes by creating systems and conditions that not only allow people to survive and have access to their basic needs, but really kind of thrive in their lives and live with a sense of dignity, kind of agency over their lives, and also meaningful social connections and relationships. So, I guess, in other words, if I were to sum up public health, I would say I think about it as moving beyond treating disease and kind of thinking about why disease arises in the first place. So, again, kind of going back to the idea of systems, you can think about how health might be shaped about having access to housing or education, healthcare, community, and kind of what we can do on a public health perspective to not just improve these systems for people, but kind of transform them.
Totally. And I think that unique aspect of public health is that systems focus, right? When we think about healthcare or therapeutic settings, that like my background, for example, is in social work,
Mhm.
and there's this sort of expectation that those are fields that deal with the individual, helping the individual navigate through life, right? And public health is a way of stepping back and saying, no, there's a system in play here. And one of those systems that isn't always talked about in the public health setting is the criminal justice system or the carceral system. So this idea of incarceration as a solution to a public or perhaps most people think about it as an individual, a private problem, but we like to think about it as a public issue, right? So how would you say that there are more interesting things or things you had never thought about before that you learned while you were spending your time in the courtroom and using that public health lens?
Yes, absolutely. This was a really unique internship in terms of not just being able to do the research and learn more about the justice system from a public health perspective, but actually having the opportunity to kind of observe in person a lot of these meetings and seeing how, I guess, public health principles are put into action, which was really cool. I wasn't too familiar with, I guess, like the inner workings of the justice system before. And I was curious coming into this internship, exactly how public health would play a role, I guess. But after these 10 weeks, I'm really, I guess, learning how, in the context of the justice system, public health is really offering a way to kind of reimagine accountability as healing and as recovery and providing the needs and support for people along their reentry journey, and looking at it kind of as a collective responsibility to change the system, like you mentioned, and I guess not putting like the sole pressure on the individual, I'd say.
One of the things you mentioned at the start was this idea about public health principles, right? And one
Mhm.
of those is the concept of the social determinants of health. So, for people who
Absolutely.
don't know about that phrase or what that means, can
Yeah.
you talk a little bit about what it is and then how you see it arising in the criminal justice setting?
Yeah, absolutely. And this is something that I'm focusing a lot of my work on. So, in my concentration of health and social behavior at Berkeley, it's kind of another way to say the social or the structural determinants of health. So, this is again kind of going back to the systems level. We're thinking about kind of the world we live in, the conditions and the systems around us, and how this shapes our health outcomes. So I would say for people who are involved in the justice system and reentry specifically, they face an intersection of health challenges, but also health challenges that, again, stem from these kind of structural conditions. So, for example, um, we can see that people have unmet physical health needs, also unmet mental health needs, including substance use disorders. A lot of people might have challenges with housing insecurity. They might have exclusion from healthcare access or employment opportunities. And also, kind of moving beyond those initial factors, we're considering kind of the social aspects. So, social isolation can be really harmful, kind of chronic stress that can build up in the body and actually become toxic to you. That can come into play for many people as well. And again, these really aren't just individual challenges that kind of pop up in people out of nowhere. They're kind of the result of policy decisions that have been made, systemic racism and exclusion of certain groups throughout the country. And this has actually made incarceration itself, I would say, kind of a driver of poor health.
Um, And you've talked a little bit about this. We sort of alluded to the things that you've observed and seen, and so that what we're talking about are the collaborative court programs that you actually were able to literally go and observe and watch the ways in which the system interacts with individuals in what is meant to be a much more collaborative setting.
Mhm.
Specifically, in your case, in the Northern District of California, being able to attend some of their different types of reentry courts that they have that are focused on different subsets of individuals. And so we like to think about the collaborative court as a public health intervention in and of itself, right? It is a different way to support individuals through what is still a system, right? We're still working within the confines of a legal system that we
Right.
have here in the US, but it's a way to kind of reimagine some of the ways in which we can actually interact with individuals. And so, one of the things that you've mentioned before that I find a really powerful statement is this shift in focus from punishment to care. So,
Mhm.
can you tell us a little bit about what that looks like in the courtroom for you, what you've seen?
Yeah, absolutely. It was really powerful and informative to be able to actually observe these collaborative courts. It's always different to kind of see how this plays out in person compared to just reading about it. So I thought that was a really valuable experience that I was able to observe these court programs. And yeah, these collaborative courts really take a holistic approach, which I love and is kind of a core of public health. And in terms of the concept of replacing punishment with care, it's really recognizing that a lot of these justice involved individuals are navigating chronic health conditions like addiction, mental illness. They might have histories of trauma. So it's kind of understanding this background and meeting people where they're at. So an example that I saw in the courtroom was a client who shared that he ended up relapsing, and instead of this kind of being met with punishment from the judges or even other people that were in the program, it's really met with a um, different lens of how we can get people the support they need rather than punishing them. And I think collaborative courts are just really important because when we think about incarceration as a public health crisis, it just provides an alternative to this system. And instead of kind of perpetuating punishment on a large level, it's really getting support to people that they really need, which not only improves their individual lives, but then kind of goes back to system level outcomes of overall reducing recidivism around the country.
And one of the ways in which a lot of systemic barriers and failings of our system show up in people is through trauma, right? And these are all individuals who, at the end of the day, have also experienced trauma in their own lives and in their own ways, and are in, for the most part, reacting to the world around them. And so, would you say that a lot of the work that you've seen taking place in the courtroom, in addition to embracing this concept of harm reduction.
Mm.
Were you also able to witness some of that, this sort of concept of trauma-informed care, like understanding that everyone here is, we've talked about this sort of holistic concept, that everyone at the end of the day is a human. These are human-centered problems, and it isn't something that you can just sort of have a calculation and a script for, right? Every individual should be treated differently, and so to be met where they are. So, can you talk a little bit more about maybe ways in which you experienced this concept of trauma-informed care?
Yeah, absolutely. This was something that I noticed right away in the courtroom. So in these meetings, there's not only kind of the diverse treatment team, but there's also the judges there as well, and kind of various different members of court staff. And you can see with the just the way that they interact with clients. Again, they don't use kind of a tone of punishment and negativity. It was really I would say like every interaction I witnessed was kind of using a strengths-based approach and really kind of centering empathy to again understand kind of why people might make certain decisions or respond the way they do. And instead of looking at this as a problem, it's just understanding and then kind of providing support instead of kind of taking away or punishing them. So even like small things I witnessed, like icebreaker questions at the beginning of the meeting, everyone went around and kind of shared one thing that they were proud of that happened in the past 2 weeks. So I think it's just little things like that. And even again, when people did talk about relapse, it's just met with support and empathy. And when people have to stay in the program for a little bit longer, it's not looked at as a failure. It's looking at extra time in the program so they can receive the support they get. So I really think just the whole setting of it is kind of embodying these principles of trauma-informed care and harm reduction. And you can see that this resonates well with clients and that it really contributes to trust being built up over the course of these programs, which are, I think, really essential for their success too.
So I want to talk a little bit about what those supports are. So in the context of what A Curii brings to the courtroom as a support system, right? We have our professional mentorship initiative, so matching clients with mentors to help guide them on their professional journey through that growth, whatever that looks like. If it's as basic as resume support, or interview helping with interviews, to really understanding what career pathways might make the most sense for you, etc. And then we have resource referral, so getting clients connected to resources in the community that run the full spectrum, everything that touches those social or structural determinants of health that we talked about, from housing, employment, job readiness training, some of those more immediate needs like food, clothing, those kinds of supports that folks need. I mean, I guess I kind of answered the question myself around how do they meet the address social determinants of health for clients. But maybe you could talk a little bit about the ways in which you saw those supports coming to life in the courtroom and afterwards, right? Because we do a lot of work outside of the court. But do you
Yeah.
have any other specific examples, or just in general some themes that came up for you in that you were able to see sort of culminate in being able to provide people with like real-time support to help get them what they need in the community?
hmm Yeah, I think overall the work that A Curia is doing from every angle, I really look at it as kind of public health in action, which is really cool to see. So like you said, it's not only addressing social determinants of health by kind of connecting people to what they need and kind of bridging the really fragmented systems like healthcare, education, housing. Something I think a lot about is not just how essential these needs are, but how hard it can be to actually access them in terms of like administrative burden and logistics. Systems are so fragmented in this country. So it really is helpful for people to kind of address their health through providing them kind of a more feasible way to go about getting their needs met, which is really important. So I think that's something huge with resource referral. And then with PMI, one of my big takeaways was how it's really kind of it's not just supporting longer term economic and kind of educational stability either through equipping people with kind of the professional goals and kind of strategies they might need. But the process itself is really cool to kind of learn about and observe because it really takes a collaborative approach in terms of goal setting. And then I think the mentorship component is something really important as well. This kind of provides almost an aspect of kind of peer support too, which is really important. And these meetings also kind of serve as I guess, a site of social interaction, even if that isn't the main goal. It just is important for people to connect with one another in different settings. So we see this professionally through PMI, but then we also see this kind of outside the courtroom in terms of A Curii hosting a community day, which we had last weekend. We can see this even in the virtual art gallery that A Curii has, kind of a digital platform to share your work, express yourself. And then also volunteer days. A bunch of folks went over to the Presidio Tunnel Tops a few weeks ago to volunteer. So it's really about again, the idea of moving beyond just getting people the needs, that they need to be met, but also providing sites of kind of connection and personal growth too.
I love that you mentioned those items because it's something that we've talked about before as this concept of these non-traditional spaces that foster
Absolutely.
healing and community, right? And one of the, I know I happen to know that one of the topics that you did a lot of research for us was on social connection. So do you have a little bit more that you can share with us if you remember from your the research that you did around why that social connection is so important? I think it's something that we all take for granted a little bit. Or
Yeah.
maybe we thought about a little bit more deeply during COVID when we all had to isolate. But can you talk a little bit about why it's so important for this community in particular?
Yes, absolutely. Social connection. This was one of my favorite topics, I think, that I researched this summer. The 2023 US Surgeon General's advisory was about this topic and kind of posed loneliness and social isolation as really an epidemic in the country. And I remember one statistic in particular really stuck out. It was that chronic social isolation can have the same level of negative health impacts as smoking up to 15 cigarettes a day, which is
Wild.
so wild to think about. So I think it's really important to focus on this aspect in terms of the reentry population because I think it is something that is probably a little bit overlooked at first, which again, makes sense why that might happen in terms of, I guess, focusing first on getting people the support that they really need, somewhere to sleep at night, food to eat, a job. But then it's important that we don't stop there. And again, we kind of move beyond and we say, okay, what can really make people feel supported and thrive? And I think social connection is really, really important. So I love that AQREI is also taking that into consideration in the work they do. Because yeah, I think it's really evident that healing doesn't just happen in the courtroom or in medical clinics, but it's kind of the everyday interactions we have, the communities we feel connected to. And yeah, I think just providing social engagements and spaces to kind of foster these ideas of a sense of belonging too is really important when we think about this. So yeah, I love that AQREI is recognizing this, focusing this, and expanding this even. Because I know we just had the first community day, but Wyatt and I spoke about kind of that this would be the first of hopefully many events like this. So it really is cool to see not only, I guess, the growth of the organization, but that I guess the growth that we want to achieve is really kind of evidence-based. And yeah, social connection is a huge part of that.
Yeah, it really, especially this part of our conversation too, highlights for me that one of the visions that I have for A Curii is to continue to be able to normalize that like justice involved people are people.
Yeah.
We're still so many barriers in place and stigma that's associated with folks that have had to go through and navigate this pretty intense system. And they're still struggling with being able to get jobs, get housing. And so having these opportunities where we can all be in the community together to demonstrate the ways in which we all care, we all are here to support one another, and that we all have a place that we belong, I think is really
Mhm.
critical for us to be able to move the needle on actually making a difference in the lives of people who are part of the reentry population, right? Like we we can't really help folks re-enter the community if the community isn't there ready to take them in. And so I think us being out in public and demonstrating the ways in which we too are here to exist and give back and be a part of our communities is really critical. Are there any challenges that you have seen? Any questions that arose for you during your observations that demonstrate to you we there's like oh we are and there's still room for us to grow?
Yeah, I think one thing that stood out to me during one of my first observations in the courtroom was And I don't believe this was specifically for a collaborative court program, but I think the idea kind of translated over to the population we work with. It was just the idea of language accessibility. At one of the hearings that I witnessed, the client was Spanish speaking and the judge only spoke English, so they used a translation device throughout, which was really interesting to observe. And it just made me think about language accessibility on a broader level. Um, I remember the judge asked the client to share, it was a time for him to speak if he had anything to say. Um, and the client said that he didn't, and the judge noted how that was pretty unusual. And I just was curious if that was maybe due to the language barrier in the translation. So it kind of got me thinking just about the idea of like agency in the courtroom and how that can be tied to kind of lack of language accessibility and translation services, broadly speaking. Um, so I guess just thinking about that, as well in the clients that we serve. Do we have translation of any services? Do we offer support to people in, I guess, like culturally diverse ways with kind of accessibility to different languages? And obviously, I think that is an area to grow. It's not yeah, I would say that is the major one I thought about. And I think that stands for, again, every system and every organization in literally in the United States as well. I think that's an area that there's a lot of room for growth. So not just tied to AQI or the court system, but yeah, definitely something to always consider, I think.
Oh, 100%. I mean, we know that our systems are people of color are overrepresented in both
Yeah.
healthcare setting, folks suffering from chronic conditions, as
Mhm.
well as obviously in the incarceration setting. So,
Yeah.
um, you would think that we would maybe find ways to be a little bit more thoughtful about the resources that we put in place to serve the specific populations that we know are going to be present. So that's a really, really good call out, and I'm glad that you witnessed that. Sounds like a really interesting area for further inquiry, I think.
Mhm.
Well, I
Absolutely.
hate to, I don't want to rush us through to the end here, but in our last couple of minutes, I mean, it's been a pleasure speaking with you as always. Are there any other nuggets, any other observations or, you know, parting wishes that you'd like to share with either a Curii or just this, this system as a whole, like folks working in this space? Is there anything else that you feel is important for people to know?
I think. I think one of my big takeaways is kind of just looking forward to the future. I'm just excited to see not just the growth of a Curii, but I really think that collaborative courts are such an effective model and such an important public health intervention that's desperately needed by the criminal legal system. So I'm just excited to hopefully see the expansion of these courts throughout the rest of my lifetime. And even in other models like mental health courts, it would be interesting to see if that gets implemented in the Northern District of California. Yeah, I just think I think it's great work that's being done, and I think it's an area that still has a lot more potential that can be tapped into around the country. So I think it just really speaks to the importance of, I would say, like cross-sector collaboration, because it might not be something you initially think of when you think about kind of the diverse team that works in collaborative courts. But I think just a huge takeaway is that it's always valuable to kind of work with other sectors and come up with creative solutions to not just benefit people, but kind of change systems overall.
100%. Well, it has been an absolute pleasure speaking with you, Haley, and we super look forward to following your career in the years to come. I know you'll be around with us here for a little bit moving forward, but we're definitely going to miss you on the daily.
Yes.
So thank you again for your time today. This was a really powerful discussion that I hope folks find something really useful to take away with them. So thank you.
Of course. Thank you so much, Janae.
Okay.